Thank you so much, Mr. Chairman. I move to strike the last word. Thank you. Well, I agree that it is critical that the NIH Improve initiative has sufficient and consistent funding, which is why I support the NIH Improve Act and the amendment to secure the funding. I also agree entirely with what my colleagues, Representatives DeGette and Kelly, just mentioned about the shameful maternal mortality rates in this country. In where I live in Houston, Harris County, we have one of the highest maternal mortality rates in the country and in the developed world. And it's just absolutely essential that we have funding for research on maternal care and mortality to address this crisis. And this bill is a really important part of this research. We have to understand what is happening, why it's happening, and how we stop it. So while I support this bill and this program, and I'm an original sponsor of the Momnibus, original co-sponsor of the Momnibus package, so much important work we need to do around maternal health care, we really can't talk about research funding without acknowledging the cuts that the Trump administration has made to women's health programs and to the NIH. And this Congress has done nothing so far to prevent the administration from making these cuts, slashing these programs, and attacking women's health care more broadly. Over the last year, the Trump administration has obstructed the important, essential work of the Title X family planning funding program at every turn, from freezing its funding to firing the civil servants who administer it. And President Trump has proposed eliminating the Title X program again in his fiscal year 2027 budget. And, you know, I like to say Title X was born in Texas 7 because it was introduced in Congress more than 50 years ago by my predecessor in this seat, Congressman George H.W. Bush. He was the person who introduced this program in Congress. It has long had bipartisan support, and I hope that we can come back around to having bipartisan support for family planning funding, just as today we're seeing bipartisan support to address the maternal mortality crisis. We need these essential family planning funding funds and programs, and we need preventative health care services. And so, you know, among the actions that we've seen in the last year, the one big beautiful bill prohibits Planned Parenthood health centers from receiving federal Medicaid funds for a year, and that cuts off essential health services. When we're talking about women's access to health care, we cannot keep them from the places where they go to get that health care. And women across this country have relied on Planned Parenthood for generations to get reliable, accurate, appropriate medical health care, reproductive health care. And this Congress is cutting them off from the providers that they go to for that health care. And so we need to do better, and we can do better. There is no reason why we can't come together to support the health of all women through their pregnancies and throughout their reproductive lives. And so we just need to work to ensure that we protect these essential programs like Title X from attacks from this administration and from the groups that want to separate women from access to care. And in addition, as I mentioned earlier, with just the minute I've left, I'm really concerned by this administration's grants overall, the cuts to NIH. And, you know, over the last year, I've heard from so many people who work at the Texas Medical Center and who live in my district who have struggled to maintain their research projects because of the cuts to the NIH grant funding and the failure to issue the funding opportunity notices. And I think we talked about this in a hearing in our subcommittee, but since taking office, the Trump administration has terminated 2,300 NIH research grants and eliminated almost $2.5 billion in research funding. Why? I don't know. Was it so the president could create a slush fund to give out to people who attacked the Capitol and Capitol police officers on January 6th? I don't know. But we need to make sure that we are not allowing that, either of those things. We can't cut NIH funding, and we should all vote against this slush fund when it comes before us. So with that, I am running out of time. I want to thank you for the opportunity to share my thoughts on this. I encourage everyone to vote for this bill, and I yield back.